When you think about breast cancer, you don't necessarily think about men, but apparently more and more men are suffering from this disease. According to the National Cancer Institute, more than 2,100 men will be diagnosed with breast cancer this year, and around 450 of them will die from the disease. Joining us tonight to help raise awareness about male breast cancer, Dr. Linnea Chap, who specializes in oncology. Welcome.
Thank you.
When you think about the number of 450 men compared to how many women who die from breast cancer every year?
Oh, it's very different. That's why it's a very common disease, as we all know, in women, and that 1 out of 8 will be affected during their lifetime, and nearly 210,000 women will be diagnosed per year. The incidence in men, on the other hand, is less than 1%, so I think it's, in contrast to female breast cancer, there's very little awareness that men can develop this disease.
And why is there such little awareness? Is it because typically breast cancer is a women's disease and people think of male cancers and they think of prostate immediately?
Absolutely. It's lack of awareness.
And what are the symptoms? Are they different for men?
You know, typically the symptoms can be very similar. Most commonly there will be a lump or a mass that the man feels behind the nipple. And there can also actually be other changes of the nipple, such as a bloody discharge or ulceration, and often is at a more advanced stage because there isn't much breast tissue. So it can actually be larger and even go into the skin or the muscle because there isn't much room for it to grow.
Well, and the one thing we hear about with breast cancer for women is early detection will save lives and makes all the difference. You don't have that luxury with men, do you?
No, and that's one of the problems with male breast cancer, and the differences is that it's often a delayed diagnosis because of the lack of awareness and men not being aware that their symptoms could actually be breast cancer.
Are there some men who are more prone to this kind of disease? I mean, what does it attack some men and certainly not a great majority of them?
Yeah, well, the primary risk factors that we are aware of, the most important is family medical history. So if there's a family medical history of breast and or ovarian cancer, especially if there are several relatives in that family, it should raise suspicion that there may be a hereditary form of breast cancer.
And what about ages for men? I mean, typically you think about men getting prostate cancer when they're in their late 40s and 50s. What about breast cancer?
Well, that's one of the differences as well with male breast cancers. It does tend to occur at a later age, more in the range of 60s to 70s, so about a decade later than it does in women.
Is the treatment different at all?
No, it essentially is the same. So we extrapolate from how we treat women for breast cancer to how we treat men.
And what's the initial reaction when you have a male patient and you explain to him, you have breast cancer?
Well, I think that's another very important difference to distinguish between female and male breast cancer is that obviously a cancer diagnosis is terrifying for anyone who hears those words. But now you're telling a male that he has what is typically thought of as being a female disease. So with that, there can be, in addition to fear, embarrassment, isolation, not having other people to talk to, and even affect what they feel is their masculinity.
Well, you know, we talk about women, sometimes they talk about hormones that women take exacerbate this situation for breast cancer. Is there anything that men can look at, i.e. progesterone or estrogen or anything like that? Is there an increased level in their system that makes them more prone to breast cancer?
Well, that is one of the other risk factors. There are a few conditions in which men have elevated or higher levels of estrogen, such as cirrhosis, and a relatively uncommon genetic disorder called Klinefelter's disease.
And screenings for men. I mean, we know about the typical screenings for women. If they are the same, it wouldn't hurt to repeat them.
Well, the incidence is so low that the argument would be that it's not cost effective, given that the incidence is less than 1%. But on the other hand, if there are risk factors that they should be discussed with the person's doctor, in particular family medical history, if there's Ashkenazi Jewish background, those are men that are higher risk whose screening should be considered for.
And who do you go to? Your regular OB? I'm sorry, you wouldn't go to an OB if you were a guy.
Not going to the OB.
Yeah, we do. But you're like a general practitioner or an internist or something like that.
Yeah, a solid, good, well-trained internist should be sufficient.
All right, doctor, thank you so much for coming in.
You're very welcome.
Appreciate it.